Hello everyone and welcome once again to my channel. I'm Gwendolyn Halle, a medical microbiology certified in the UK, and I'm popularly known as the medical professional with the difference because I bring you knowledge on health, medicals, business, and a lot more. Today we'll be answering some very interesting questions from some of my viewers. And the question is, can a woman with fibroid get pregnant? And also, what actually causes fibroids? What is a scientific proven cause of fibroid? If you're just joining this channel, don't forget to like, share, and comment and increase the visibility of our channel. And most importantly, join this beautiful family because we love you. If you're a returning subscriber, I want to say thank you. So much love, so much hugs. Thank you for enjoying my content, for commenting, for sharing, and may God increase you. Brace yourselves. Welcome back. Now we'll be looking at uterine fibroids. Now, let me start by defining what a uterine fibroid is. A uterine fibroid is a non-cancerous growth that grows in or around the uterus of a woman during her childbearing age. What is the cause of fibroid? What causes fibroid? The truth is, there's no scientific proven research or actually result that actually states or proves how fibroid is caused or what causes fibroid. In fact, some Christians or in the Christian religion actually link fibroids to the sperms of a spirit husband in a lady. What are the signs and symptoms of fibroids? Uterine fibroids. In fact, the signs and symptoms of fibroid will depend on the location and the size of the fibroid, and this varies from woman to woman. The first symptoms is a swollen abdomen, and some women you'll find them with a very swollen abdomen. Painful periods. When you have a fibroid or uterine fibroids, you'll start experiencing painful periods. The next is heavy bleeding. If you were a lady who was having regular periods, like light periods, if you have uterine fibroids, you experience very heavy periods with very thick and dark clots of blood that will come out through you. This is an indication that you are having uterine fibroid. Another is infertility. You'll be struggling to have kids or to get pregnant and it will never happen. Prolonged menstruation. You'll find a lady who used to have maybe her period would be for 4 to 5 days, but when she has uterine fibroids, the periods are going to lengthen till about 7 days, and this is a call for concern. Some women are asymptomatic. Some women have no symptoms at all. Some ladies experience irregular menstruation. That means their menstrual cycle will move from maybe a 28 days to a 30 days to a 24 days. In fact, the length of her menstrual cycle would just be a complete mess. Most women will experience bleeding after sex. After being intimate with their spouse, they'll experience bleeding after sex. Some women will experience bleeding between periods. That means that you will not be on your period, but you will just notice that you're passing out blood. You're actually bleeding between your your last period and your next period. Some women experience miscarriage because the fibroid may actually grow to a certain size that it inhibits the growth of the embryo. So this is why I say it is very, very important that we know actually the location and the size of the uterine fibroid. Some women experience abdominal and back pain, which is common with women who have irregular period or swollen abdomens. There are 4 different types of fibroids. and they actually appear in different locations in the body, either outside the uterus, either in the muscular wall of the uterus, either in the muscular layer of the uterus, or some come out with a stem, somehow like mushroom shaped, or like a flower that is about to bud, the intramural fibroid. It's a very common in a lot of women, and it grows in the muscle of the uterus, and it grows extremely large. In fact, it expands the uterus. It's subcerebral fibroid, and that grows outside the uterus. The next is pedunculated fibroid. This appears like a stem that is supporting a tumor. That means you find a tumor and you find a little stem. Let's say this is the tumor, and then you have this as a stem. And this is normally found in the uterus. And the last is submucosal fibroid. And this is found in the middle muscular layer of the uterus. Now, going to our question, can a woman with a fibroid or with fibroids get pregnant? And the answer is yes. That would depend on the location and the size of the fibroid. In some cases, the fibroid will have to be taken out before the woman conceives, and in some cases, there's no need. The baby can grow alongside with the fibroid. And in most cases, most of the ladies who have fibroids give birth to C-section, because sometimes the doctor will want to use the opportunity to take out the fibroid while the baby is being delivered through C-section. So these are things that every woman who has fibroid should consult their doctor. And there are some women who don't know they have fibroid until, let me say, several tests and scans, and they find out that they have fibroids. It is also very important to know that most women who conceive, who are pregnant with fibroids, because it's very possible for a woman to get pregnant if she has fibroids, normally give birth through C-section, and some actually have premature delivery. So this is very important that you consult your doctor, your gynae, for advice, and also get the best help you can get concerning this issue, because fibroids can actually trigger miscarriages, because they have a way of growing in the body and manipulating the womb and taking possession of your womb when that shouldn't be the case. Now, what can influence a woman to have fibroid? First, you have to know that a woman during her childbearing ages has high estrogen. Now, some women have higher estrogen due to the kind of foods they eat. So that will depend on your diet and at what age you are. There is a time in a woman's life when her estrogen levels are high. That's actually to promote conception and childbirth, pregnancy, support pregnancy, etc. Now, the next is family history. What's in your family history? If you're a lady and you notice that in your generation, your mom, your grandmom, it's in your family, you guys are very, very prone, or many women have had uterine fibroids, then it's something that you should be thinking of checking regularly if you have it, and also knowing how you can handle it when you find out you have uterine fibroids. The next is pregnancy. This is why it's very important for a lot of women to go for scans while they are pregnant, because due to the high level of estrogen and progesterone in the woman's body, some uterine fibroids may just start to develop. Remember, there's no known cause of fibroids, no scientific proven cause of fibroids. So this is something that every lady should know. And if you're very prone to fibroids, let me say due to your family history or You've noticed probably with family history where you know that your grandparents, your ancestors have had fibroid all through. This is something to actually look into and actually watch what you eat. It has been scientifically proven that eggs have a high level, chicken eggs have a high level of estrogen. So it's normally advised that if you are a woman who is actually pregnant or notice that you're very prone to or susceptible to fibroids, uterine fibroids due to your family history, it's good that you reduce or limit your intake of eggs and certain foods that may trigger the growth of fibroids in your body. So thanks for watching again. Thanks for joining me in this class. Thanks for subscribing. Thanks for loving and, spreading the video. Till next time, I remain your favorite medical professional, Gwendolyn Halle. Bye-bye.